Hello students, today I will talk about menstrual cycle. Menstrual cycle is characteristic of primates, that is monkeys, apes and human. It starts at the time of puberty and the period is called menarche. Menstrual cycle lasts for 28 days. The days are numbered from the first day of blood flow in the menstrual cycle. It involves a series of cyclic changes in the ovary and the female reproductive tract, mainly in the uterus. These changes takes place under the effect of gonadotropins. Gonadotropins are the hormones synthesized and released by anterior pituitary and the ovarian hormones respectively. The ovarian hormones are estrogen and progesterone. The cycles are repeated with a periodicity of approximately 28 days. The middle of each cycle is characterized by release of an egg. This egg in every cycle comes alternately from one of the two ovaries. For example, this month the left ovary secretes produced egg. The next month the right ovary will produce the egg. Menstrual cycle consists of menstrual phase, proliferative phase, that is follicular phase, also called post-menstrual phase, ovulatory phase and secretory phase, that is luteal phase. Menstrual phase, the beginning of each cycle is taken as the first day where menses or loss of blood takes place and it lasts for approximately 5 days. The average is 3 to 7 days. The endometrium of uterus breaks down under the effect of prostaglandin released due to decreased level of progesterone and estrogen. Due to this, blood, tissue fluid, mucus, endometrial lining and unfertilized oocyte is discharged through vagina. The endometrial lining becomes very thin, that is about 1 millimeter. The menstrual discharge continues for an average of 5 days. However, this blood does not clot due to presence of fibrinolysin. Menstrual phase occurs when an ovulated egg does not get fertilized and it is thereby shed out along with menstruum. It is thus called funeral of unfertilized egg. During these 5 days, many primordial follicles develop into primary and few of them into secondary follicle under the effect of follicle stimulating hormone. Proliferative phase, that is follicle phase or post menstrual phase. This phase is the duration between the end of menstruation and release of ovum, that is ovulation. Duration of this phase is more variable than other phases. Generally, it extends from 5th to 13th day of menstrual cycle. A few 6 to 12 secondary follicles proceed to develop, but usually one of them develops into Graafian follicle, that is mature follicle. The other secondary follicle degenerate. This process of degeneration is called atresia. developing secondary follicle secrete the hormone estrogen. The stimulation for proliferation of new follicle is influenced by GnRH, which stimulate release of follicle stimulating hormone. Endometrium begins to regenerate under the effect of gradually increasing quantity of estrogen. Regeneration also involves formation of endothelial cell, endometrial or uterine gland, and network of blood vessels. Thickness of endometrium reaches to 3 to 5 millimeter. Ovulatory phase. It is the shortest phase of menstrual cycle. It involves rupturing of the mature graphium follicle and release of ovum, that is secondary oocyte, usually on 14th day of menstrual cycle. Rapid secretion of luteinizing hormone by positive feedback mechanism causes the mature follicle to rupture. Ovulation may be accompanied by mild or severe pain in lower abdomen. Secretory phase, that is luteal phase. Duration of this phase is between the ovulation and beginning of the next menses. This phase is the longest phase. It lasts for 14 days from 15th to 28th day of the cycle. After release of secondary oocyte, remaining tissue of graphium follicle transforms into corpus luteum under the effect of LH. Corpus luteum begins to secrete progesterone and estrogen. The ovulated egg may get fertilized within 24 hours. However, in the absence of fertilization, if the egg is not fertilized, corpus luteum can survive for only 2 weeks and then degenerate into a white scare called corpus albicans. The corpus luteum releases progesterone, small amount of estrogen and inhibin. Under the influence of these hormones, the endometrial gland grows, becomes coiled and starts uterine secretion. Endometrium becomes more vascularized and thickened up to 8 to 10 millimeter. Inhibin stops secretion of follicle stimulating hormone. These changes are necessary for fertilization and subsequent implantation. However, if the ovulated egg get fertilized and the embryo is implanted, there is secretion of human chorionic gonadotropin (HCG), which extends the life of corpus luteum and stimulates its secretory activity. Presence of HCG in maternal blood and urine is an indicator of pregnancy. In absence of fertilization, next menstrual cycle begins.